what about people who don't have pre-existing conditions, people who don't have employee coverage but are getting a good deal on their insurance right now? Well, as Drew Griffin found out, many of them say the new law is going to cost them.
Christy Metzger and her husband Mark are both 29 years old, healthy, with 2 healthy baby girls and one big problem. Their health care company has informed them their current plan will cease in the next year because it doesn't comply with the Affordable Health Care Act. She needs to find a new plan. So Christy, a part-time teacher, and her husband, who owns a video company, went online. And after a week of trying, finally figured out just what kind of insurance she could get under the Affordable Care Act. And for her, it seems unaffordable.
And when I logged on, I was like, no, this is very bad. This is much higher than we were currently paying.
Their current plan costs $450 a month with a $5,000 family deductible. The bronze plan she found under healthcare.gov will cost her $650 a month with a deductible somewhere between $3,500 and $6,000. Christy says she has yet to find out if she qualifies for any subsidy.
It was very frustrating because we'd like to know for planning for the future.
Joshua Strickland, who owns a small business in North Carolina, spent 2 weeks trying to get on the Affordable Care Act site and couldn't, so he went to his own insurance company, Blue Cross Blue Shield, which was able to give him quotes for both his renewal under a private plan and his quote under the Affordable Care Act. The results, no matter which way he goes, he will be paying much more.
What I found was that the plans made available were almost twice as expensive.
His renewal under his current plan will increase by 9.8% to a monthly cost of $540. His deductible will jump too, actually doubling from $500 to $1,000. Under the Affordable Care Act, he says, the most comparable plan for himself and his 3 children is much worse. He was quoted $838 a month with a $1,000 deductible, and that is after taxpayers kick in a $150 per month subsidy.
You feel like we were told, number one, overall health care costs would come down no matter where you got it from, and perhaps number two, the government cost, if you went on the Affordable Care Act, would be at least lower. And you're seeing increases on both ends.
That's correct, Drew. You hit the nail on the head with that. Definitely, I was expecting to see more options or more affordable plans available. And for the numbers I ran, as for myself, I saw just the opposite.
Then there is 56-year-old Helen Cummins of Georgia. She retired early from an airline and now has a new government job making $24,000 a year. She has chosen to have no health insurance. If she currently needs help, she goes to a hospital and pays the prorated cost for uninsured patients.
You must have been somewhat excited that you might get health care insurance.
Oh, my God. I was so totally excited.
When she finally got through, signed up, and found out she would not qualify for a subsidy or Medicaid, she learned her cheapest option under the Affordable Care Act is between $357 and $387 a month with a $6,000 deductible. It's just too much, she says.
I was hurt. I was truly hurt because of the fact that I was expecting better. I was really expecting better.
The White